I worked in Kaiser. I worked for Kaiser in California for a year in the emergency room. I was a brand new nurse recruited out of nursing school. When I started my position, it was normal for an emergency room nurse to take 8 to 10 patients. Because this was my very first position in a hospital, the learning curve was a 90-degree angle. My very first night was a shocker for me. The nurse that was precepting me had been a nurse for 6 months. She had a very large patient load, 8 patients, and one of the patients had been extremely intoxicated and had been very belligerent. And that time, anybody who was belligerent or out of control would immediately go into 4-point leather restraints, not the soft restraints that we use now, leather restraints. And we did this very frequently. And we smudged the paperwork so that it looked like it was legal and for the safety of the patient and the staff. This particular patient was removed from her, the restraints were removed from her ankle so that she could use a bedpan to relieve herself. And the nurse put her on the bedpan and then quickly left and went to go and care for her very large patient load. About an hour later, we heard a crash and a scream. The patient had gotten free of one restraint and was hanging off of the gurney. I'm sorry. She was naked. There was urine all over the floor and she had broken her hip. This was the beginning of my nursing career. And I swore that day that I would never ever allow a patient to be harmed under my care. But unfortunately, for that next year, I too cared for 8 to 10, even 11 patients at a time in a very busy 35-bed emergency room. There were times when I would drive home crying and praying to God that I had not hurt a patient. I am not over-exaggerating. I take my care for my patients very seriously. I work in the emergency room now. I work in labor delivery, both very acute settings and postpartum. And I want to be able to provide safe care. I do not feel that it is safe to be in an acute care setting where I have multiple patients, multiple medications to give, multiple things to think about, and that the last thing, my last priority, is that they're actually having a satisfactory experience in my hospital. I feel like I care for the tip of the iceberg in those situations. And patients are so complex. They need us to be able to care for the whole picture. And so with that, I won't take up any more of your time. This is such an important issue, and I ask that you will give it very serious consideration. Thank you.